Member for Prince George Valemount.
Very much, Mr. Speaker, and that is a perfect example of why we find ourselves where we are at today. I would remind the member opposite that a public health emergency was declared in 2016, and since that time, under this government's watch, 6 people a day are dying and more than 11,000 people have lost their lives. And this member wants to take a walk down and look in the past. He should look in the mirror and move to do something about this. Let me remind him of a quote. Here's a quote. We need to have better interventions that could and should include involuntary care to make sure they at least have a chance. Well, according to the members on the NDP side today, they must have forgotten who said that. It was the current Premier of British Columbia who called for involuntary care during his nomination campaign. Was that then and this is now? There is evidence, and plenty of it. More than 11,000 people have died. To suggest that we can just keep doing more of the same is absolutely outrageous. This is one of the most important issues facing our province, and it is absolutely vital, Mr. Speaker, that we have discussions in this place about doing everything we possibly can to support British Columbians, no matter how difficult that discussion might be. BC continues to experience a mental health and addictions crisis, and coupled with the overdose crisis, there is so much suffering in our province, Mr. Speaker, every single day. Every day in this province, British Columbians lose siblings and parents and children, and we simply must do better. And let's remind the member opposite that this is a government that took this House to an election during a pandemic based on this very issue. All I can say to that is shame on them. We can't keep doing things over and over again, Mr. Speaker, in the same way and expect different results. To save lives, Mr. Speaker, something must change. We have an opportunity to take bold new steps that will make a real difference. And apparently, the Premier of British Columbia thought it was a good idea during his campaign to become the leader. So what has changed? We need a new approach, with people, their health and well-being at the center of the actions we take. We need to create an accessible, no-cost, recovery-oriented system of care. We have to do more, and a focus on helping people get well is critical. We have a responsibility as leaders to do our very best to make this a reality for every single British Columbian. Now more than ever, we must treat this issue like the crisis it is. We heard over and over again on the Select Standing Committee on Health that we need to stand up a response to this crisis just like we did when we were facing a pandemic. And when we act with urgency, dealing with this crisis, we have to do everything possible to make decisions that include the health and safety of everyone that is involved. Of course, we have to prioritize keeping people alive, and that will sometimes require difficult decisions, including, and I will say it again, the limited use of compassionate involuntary treatment. The time has come, Mr. Speaker, to bring forward legislation allowing involuntary treatment for our most vulnerable. As we know, the current Premier of British Columbia called for that during his campaign to become the leader of this province. The people who are at risk of harm to themselves and others, they need us to make bold decisions, not institutionalizing or warehousing people, but keeping them safe and providing them with modernized, compassionate care, which includes intensive 24/7 psychiatric and medical supports. We have all said it over and over. Involuntary care should always be a last resort. But there are situations, Mr. Speaker, that we believe where it is necessary for the health of the individual and those people around them. The issue is complex, emotional, and challenging, but we have a responsibility to British Columbians to be prepared to have those tough conversations that will ultimately, Mr. Speaker, lead to a better system of care, and most importantly, improved results. While prevention, early intervention, and treatment must be the main focus, It is time to include involuntary care in our response. And with bold new action and a new approach, I am convinced, Mr. Speaker, that better is possible.